Good morning, sir.
Hello.
How are you?
Good. How about you?
I'm good. My name is Dorothy Heron. I'm a student pharmacist, and I see that you've been having problems trying to find your medication.
Yes, ma'am. I'm looking for something for a skin rash.
Okay, we can definitely find something for you. Is what you're looking for you or for somebody else?
Yes, ma'am. It's for me.
Okay, all right. Okay, I can definitely help you find something for your skin rash. If you have like 10 minutes of your time, we can talk about what's going on with you and then decide what's best for you. Is that okay?
Yes, ma'am. Sounds great.
Okay. Would you mind following me then? So, what is your name?
I'm Dan Miller.
And how old are you, Miss Miller?
I'm 27.
Okay. Would you mind telling me, like, what are the symptoms you're having and how did it get started?
Okay. Really, I've just had a rash in between my toes. It's kind of red and scaly. It's pretty dry, and it definitely itches. Um, the hours at my work started picking up about 2 weeks ago. Everybody's trying to get in their summer bodies going on and everything, where it's springtime, the weather's picking up. So I started showering at the gym
Okay.
to save time and everything. It's where I work. I teach a lot of aerobics classes, kickboxing, Zumba even. And for about a week and a half, I've had the rash, and it's not really getting any better.
Okay. And can you describe the rash again? How does it look like?
It's red, it's dry, scaly, and it really itches.
Okay. Have you ever experienced this before?
No, this is the first time I've ever had a problem like that.
Okay. And when exactly do you remember first seeing the rash?
I saw it about a week and a half ago.
I know you said the rash was between your toes on your feet. Is there anywhere else on your body you may have noticed the rash?
No, it stayed pretty much just right on between my
On your
toes.
feet. And are you taking any kind of treatment for this rash?
My coworker told me it was best to keep my socks on and keep it kind of moist, and that would help. But the rash really hasn't gone away. It's still really itchy and stuff, and just hasn't gotten better at all.
Okay. And are you on any kind of medication?
No, the only thing I take right now, I take a multivitamin, like a men's one a day, and a protein supplement.
Do you have any allergies?
No allergies that I can think of.
Okay. And do you have any medical conditions that you may have been diagnosed of?
No, just whatever's going on with my foot right now is it.
Do you have any fever?
No, I haven't had any fever that I've noticed. I've been pretty normal.
Okay. And I know you talk about the itching. Is there anything that makes it worse?
When I take my socks off, the itching really gets worse. Like it just, it almost unbearable. So I just pretty much have been leaving my socks on for a pretty long time throughout the days.
Okay. Well, I think we can definitely find something over the counter that could work for you.
Okay.
So, Dan, from what we've been talking about, it seems as if to say you're having or you're experiencing what we call tinea pedis. I know it's not scary, but it's only athlete fault.
Okay.
And that is like a fungus disease that grows and spread in moist environment, in wet environment. So you definitely don't want to keep your feet covered like what you've been doing.
Okay.
You want to keep it open and dry as much as possible. You want to make sure you're washing the affected area, like your toes that have the rash. You want to make sure you're washing them like twice a day with soap and water. You want to leave it open to dry. You want to use like a dry towel, a different towel to dry that area as opposed to towel that you're going to use for the rest of your body. And you want to make sure you wash your towels and dry them on really high heat because that can actually kill the fungus.
Okay.
Don't share towels. Do not share like socks or personal items. And you definitely want to stop using the public shower like the gym, shower at the gym or public areas. Like I say again, keep your feet open as much as possible. Keep it dry. But if you have to go to like a public place, you definitely want to cover it because you don't want to spread the the fungus. You don't want to spread the disease.
Okay.
What I'm going to recommend for you today is Clotrimazole cream, 1%. This is a topical fungal medication, antifungal medication, and it has to be used like externally only. You can't take it in. You just have to apply it to the affected area. You want to make sure that you're washing that area. You wash it clean, like we talked about before, with soap and water twice a day, and apply the cream. You want to apply the cream 2 times a day. Like you can do it in the morning when you wake up and before you go to bed for over a period of 2 to 4 weeks. What the cream is going to do is going to try to relieve the itching as well as help get rid of the rash. If you're applying the cream and it seems like it's getting better, you want to still continue the treatment until it's done. You can store it at room temperature. That's fine. One important thing that I want to mention is because it's a topical cream for your skin, it has less side effects. It can cause a little burning or stinking or a little itching. And you're fine to use this cream as well as take your multivitamins and your protein supplements like you usually do. They're not going to interfere.
Okay.
So like I mentioned before, apply the cream twice a day. So you may want to do it in the morning when you wake up and right before you go to bed. But in the event where you forgot to do it, say before you went to bed, you can always start the next morning.
Okay, so I don't have to worry if I accidentally forget. I just pick up when I need to.
Yes. As you're applying it to the affected area, just keep an eye on the area, on the rash. If for any reason the rash gets worse, and if you're having any kind of allergic reaction when you apply this to your skin, stop treatment and call your doctor. And make sure you complete the entire treatment within the 2 to 4 weeks.
Okay.
So again, you want to avoid using the shower at the gym, the public shower. You want to make sure you're keeping your feet open as possible, keep it dry. Apply the cream 2 times a day, 2 to 4 weeks. Can you tell me how you're going to apply it?
All right. I want to apply it on my toes and stuff, on everywhere it's infected, in the mornings and in the evenings, just like before and after I go to bed. And I want to apply just a normal amount.
Okay. So what stuff do you want to avoid to make sure that you're keeping your feet better?
I want to avoid like vigorous exercise, you said, so I want to try to like not sweat a bunch, so I keep my feet dry. Also, you told me to stop using the public shower, try to avoid that, and I believe that was it.
Yeah, definitely. Yeah. So what other questions do you have for me?
I don't think I have any. I think that you answered everything, and I think I'm ready to go. So I just need this and take it, and then if I have any issues, to follow up with you and my primary care physician.
Yeah. Well, I'm glad that I was able to help you in your medication and choice today. And definitely, if you have a question, feel free to reach out to us, call us. And if things get worse, definitely call your physician. And I'll see you back in 4 weeks after your treatment.
All right. Thank you.